Welcome back to another episode of Spilling the Tea with Dr. T.
And Gabriel D.
That is me.
And Lava Lee.
She's back. She's alive.
Back.
She's here.
We're all here. Today, we are welcoming you to another episode where we're going to be diving into a new topic, specifically talking about something to, of course, better enhance your sex life for some people out there. Of course, that's always what we're focused on is sexual health. Today, we're going to be talking about something called a delay spray and how that can impact or improve your sexual function. Delay sprays are pretty common. I've had patients ask about them. I've had patients that have used them in the past. They can be helpful to prevent something called premature ejaculation, which we're going to get into details about as well, finding the right delay spray. But I'm getting a little ahead of myself as usual. So
Yes.
let's dive in and discuss this interesting topic.
Yeah, I have a few questions for you as always. And we are once again trying to enhance the experience of the viewer.
Yeah, let's do it.
So can you define for us what is premature ejaculation?
Absolutely. So premature ejaculation is defined as an experience in which someone is ejaculating too quickly, either for themselves or for their partner during a sexual experience or encounter. And so oftentimes patients are going to get super frustrated, or when they say, hey, I just can't prolong this for myself or my partner. And unfortunately, premature ejaculation typically results in a loss of satisfaction for one of the members of the sexual encounter.
We have another video on premature ejaculation where we give tips to the viewers how they can prolong their sexual experience. Is that right?
That's right. And typically premature ejaculation occurs within 1 minute of sexual activity, or maybe even before penetration occurs. So as you can imagine, this can be very debilitating for people out there that are looking to enjoy themselves with their partner. And of course, while this can be an annoyance, an inconvenience, an irritation during sex, it can also result in larger issues, really affecting a relationship between someone and their spouse or their partner. So happy to find ways we can improve these symptoms so patients can feel better about themselves and feel better in their relationship.
Yeah, definitely. Something as small as premature ejaculation can cause a domino effect into like psychological effects and confidence issues.
Exactly.
And so, what is the prevalence of premature ejaculation and its impact on individuals and relationships?
So premature ejaculation is a relatively common sexual disorder in the United States. About 20 to 30% of men in general will experience symptoms of premature ejaculation at some point in their lives. And so that's a pretty large prevalence. So a pretty good amount of men at some point in their lives are going to experience these symptoms. And while certainly it can be an individual's experience, and that can result in a damage to their self-esteem, their confidence, their ability to want to approach sex, can have a pretty damaging effect on relationships. Of course, if your partner thinks that maybe they're doing something wrong, or maybe their partner is not able to receive that type of satisfaction from you, it can cause a lot of strain and a lot of stress on both parties. And so trying to find ways to fix that, as early as possible is going to be the most beneficial way to improve those symptoms and to allow you to get back into the game with your partner so that you can, reduce anxiety, reduce sexual dysfunction, and, be
Have
happy
more fun.
and having fun together. Yeah, exactly.
And it can happen to anyone, any age.
Right. So it could be a young person, an older person. You could be completely fine for many years, and this could come out of the blue, or this could be something that you experienced from the beginning. So if that's you, you're not alone. There are many things you can do to help, and this is one of the methods that could potentially provide some assistance for you.
And so, what are the causes of premature ejaculation?
So there are multiple potential causes for premature ejaculation. You want to kind of break them up into three different sections. So number one could be mental health changes or mental causes. Others can be biological causes. And then finally, lifestyle factors. So initially, when we think mental health, we want to think anxiety, stress, depression. These are all major factors that can contribute to changes in your sexual health and sexual function. Biologically, we want to think of things like hormones. We want to think of things like hypersensitivity. Some people have a very sensitive response in their genitalia that can make them more prone to erectile dysfunction or to premature ejaculation. We also want to consider that genetics are a big component as well. So some people in their family history can even have this as an issue. And then finally, lifestyle factors. So sleep, if you're not getting great sleep, that can be a huge one. If your diet is not well-rounded, if maybe you're eating a lot of junk food, that can even have an impact on your ejaculation and sexual health. And of course, using substances like illicit substances or drugs can also have an impact on your sexual abilities.
It's crazy. I had no idea that diet could impact on premature ejaculation.
Exercise and diet can pretty much impact everything you can imagine. So always making sure that is somehow involved in your typical routine is going to help you stay on, peak of your health performance, regardless of what that could be.
And we never talk about health, diet, and exercise in those videos.
Exactly.
It's not important. What would you say is the average ejaculation time?
So in general, the average ejaculation time for a man in the United States is anywhere between 5 and 7 minutes. And so pretty good amount of time. But in contrast, for those that have premature ejaculation, they're going to be experiencing ejaculation as early as 1 minute, sometimes before
Mhm.
penetration even occurs. So statistically, quite a large difference there. And if you're not sure how long it's taking
Mhm.
you and you're not sure if you are in the average, something to consider trying is adding music, because then you can kind of time like what
Right.
song you're on. And that's something that can also be a way to try and increase the
Track.
duration
Mhm.
of your sexual experience if you're looking to try to prolong. It's difficult to look at your watch maybe,
Right.
or like watch the time, but maybe as the songs go on, you can kind of time how long your experience is.
Yeah, most songs are 3 to 4 minutes. So if you
Yeah.
pick a song that is around that time, you know exactly your duration.
Yep. So you should be getting at least through 2 songs if you're really going for it, or at least 1.5 songs.
Yeah. I love that because that gives you a good parameter to compare.
Yeah, exactly.
And so, what are the common treatments for premature ejaculation?
So there are multiple different options to treat premature ejaculation, which can be really great because some things may not work for everyone. So there are multiple things you can try. First things you want to consider are behavioral techniques, there's medications, and there's even therapy options to improve your ejaculation time. The common behavioral techniques include something called the stop-start method, which we talked about in a previous
Yes.
video, where you get very close to climax and then you completely stop all sort of sensation or stimulation in that area and wait until that sensation goes away. And then you continue and continuing doing that method to prolong it as long as you can. And for those even that don't have premature ejaculation, this can be a great option if you're just trying to prolong
Prolong
your sexual
experience.
experience.
Hmm.
Yeah. And so another option is going to be the squeeze method. So again, kind of similar, but in the sense when you're getting close to climax, you actually squeeze pretty much on the
Uh-huh.
shaft of the penis and hope that you are not going to reach or go beyond climax. And if it's working well, you're going to be able to continue once that feeling of ejaculation has subsided. And then you would continue that method going at it and then pausing, squeezing, and then going back at it to again prolong the experience. And then finally, you can do things to help strengthen your pelvic floor. So using Kegel exercises, which we
Right.
talked about on multiple videos, where basically you try to constrict the muscles or contract the muscles that are responsible for stopping that urination flow. So think
Wow.
about it when you're in the bathroom and you're urinating and you need to stop real quick.
Uh-huh.
Those are the muscles that you're using in Kegel. So just try to
Work
contract
out.
those, which you can do
Yeah.
right now, like sitting or whatever. And so those are all the great, behavioral methods you can use. And a lot of these can be really helpful, again, for people who aren't even concerned with premature ejaculation, but just wanting to prolong their ejaculation
And they're super
time.
simple to do.
Yeah, exactly. Can pretty much do them anywhere.
Yes.
And then, of course, there are common medications that can be prescribed to you. These you're going to need to talk to a medical professional so that they can write you the prescription. The main one is going to be something called a serotonin selective reuptake inhibitor, or SSRI. There are multiple out there, but the most common are sertraline, which is
Hmm.
Zoloft, and paroxetine. Both of these are really helpful to reduce the sensation of needing to ejaculate so early on. They
Hmm.
think that somehow serotonin is involved with that process. So that can be prescribed to you, taken once daily at a low dose. And so that dosage, while these are considered antidepressants, is not considered an antidepressant therapeutic dosage. But again, something to talk to your doctor about to make sure that it's a good option for you.
Absolutely.
And then topical anesthetics, similar to a delay spray, which is actually over the counter. This would be a strong sort of topical application that you would put on the genitals in an area that you feel is too sensitive to
Hmm.
reduce that sensitivity. I'm not a huge fan of these, only because if you use it, it can make that area numb, which could then
Right.
cause you to lose your erection or to not be able to feel anything whatsoever. So these are usually held in the back pocket because, again, these are prescription strength, so usually quite strong in comparison to something like a delay spray, which we'll talk about soon, which is lower dosage, and so it won't make such a substantial numbness effect
Yes.
if done correctly.
And also, you want to try diet, exercise, the other methods,
Right?
squeeze, stop, start first, and then you want to
Exactly.
jump to medications.
Exactly. Unless you're having severe symptoms that are really damaging how you
Hmm.
feel. Of course, you want to talk to a doctor quicker than trying things that can prolong that treatment experience. And then finally, beyond the medications, those lifestyle or behavioral modifications, you can try therapy.
Yeah.
So, cognitive behavioral therapy is typically first line in regards to when you see a therapist, they walk you through how to make sure your brain is not priming you to
Hmm.
ejaculate too soon, and learning techniques you can do to sort of volley within your brain to prevent yourself from ejaculating. And then there's other things you can discuss as well with a therapist in regards to maybe where some of these trauma issues that could be underlying causing your symptoms to improve those. But everyone's a little bit different. So, of course, you want to talk to
Yeah.
your own medical professional to see what's going to be best for you to determine how you can get yourself feeling better as quick as possible.
I love that there are many solutions. There are many
Yeah.
different routes that you can take for that.
Exactly. Some you can do on your own, some you can do with a provider.
So you mentioned a delay spray. What exactly is a delay spray?
So a delay spray is a topical over-the-counter option designed to help men prolong their ejaculation time. How it works is typically a delay spray will have a certain low percentage of an active ingredient like lidocaine or benzocaine. Both of these work to numb the nerve fibers underneath the skin. So the goal is to numb the area enough to where you still feel pleasure, but it's not too sensitive that it can result in a premature ejaculation experience. And so there's different types, there's different ingredients, and we can try to get into those. But definitely something to consider trying as it is over the counter and you don't need a prescription to use the majority of
That's
them.
great.
Yeah.
And how do you find the right delay spray?
So again, you want to look at the active ingredient. Most of the delay sprays out there are going to contain either lidocaine or benzocaine. These are very commonly used medications to numb. You can think of it as when you go to the dentist and you're numbing your mouth, they're using one of those typically. So if you have an allergy to those, of course, you don't want to consider that as an option. And there is a range of strength between these, even over the counter. So they can be as low as 2% and as high as 10%. And while some patients will say, oh, I want the strongest version, you have to understand the stronger a medication, and this is in general, usually the more likely that it can cause side effects. So the side effects you want to be aware of is the fact that this can really numb the area and can prevent you from feeling anything at all. So that's going to, of course, damage your experience. And then you also want to be aware that as you apply something topically, it can spread to your partner. So if you insert to your partner and you have the medication or the topical solution on yourself, it's going to pass to them and can actually cause them to feel numb and can impact their ability to reach orgasm or reduce their intensity for the sexual experience, which they may not be happy about. So certainly want to consider, I always recommend starting with the lowest option. And then you want to also look, are there reviews to the product? Have other people used it? Is it registered or approved by any sort of medical body? Has it been FDA approved? All these things will be listed on the packaging, but something you want to consider before, starting or using a product in general.
And so how does one use a delay spray?
So you want to start by reading the manufacturer's instructions on the label or the box of the spray. There may be multiple different directions depending on the type of spray you buy or the brand. And then in general, you want to have the spray about 2 to 4 inches away from your penis when you start to spray it. And you want to evenly spray along the head and the shaft, making sure that you wait about 10 to 15 minutes that it's able to dry and able to absorb in the product before you proceed. You can even test the area to make sure it is adequately numb and not too numb and that you still feel some sensation. Of course, you also want to make sure you wait because you don't want it to spread to your partner. Typically after about 15 minutes, it's dried and so it's not going to transfer over. You also want to make sure you're not going to have any irritation. So I always recommend something called a patch test. Maybe you spray it on your arm or your hand to make sure that you're not going to have some sort of, allergic reaction. But in general, those are the sort of idea. You want to spray, 2 to 4 inches apart from it, not too close, not too far away. Wait 10 to 15 minutes and then make sure you test it. And it's a good sort of feeling and numbness for you.
Yeah, I feel like it's important to test beforehand because you don't want to have issues in the middle of your rendezvous.
Exactly. And then afterwards, you want to make sure you wash the medication off thoroughly with a mild soap. And so it doesn't cause any irritation or doesn't, stay there beyond the necessary time needed.
Hygiene basics.
Yeah, hygiene basics.
And what are potential side effects of a delay spray?
So excessive numbness is going to certainly be the number one you want to be considered about. You want to make sure maybe you start at a low dosage option, again, 2% rather than the 10%. You also want to make sure you and your partner are aware that irritation can occur. If you haven't taken lidocaine and benzocaine in any type of modality before, talk to your partner, let them know what's going on just in case they have an allergy. Of course, you want to wait the amount of time that's appropriate so the medicine's able to dry before going into penetrative sex because that can, again, cause irritation, can change the sensation for your partner. So those are all kind of the basics. If you notice excessive numbness, maybe consider reducing the dosage and maybe not applying so heavily in the future. And of course, if you have any irritation that is severe, call 911. I mean, this is definitely something that's over the counter, so it doesn't require a prescription. I've never heard of someone having to do such a thing of calling 911, but anything can happen. We can all have a dramatic response and allergy to anything on the planet. So just be aware that anytime you apply something on your skin, whether you got it at a local store or got it in a prescription, an allergy can occur.
How does one determine if delay spray is right for you?
Well, first you want to take a look at how long your sexual experience is. Are you ejaculating too quickly? Is your partner able to reach climax? Are you able to reach climax at a time that you feel is sufficient? If you'd like to try to prolong your sexual
Hmm.
activity, you don't necessarily have to have premature ejaculation to use one of these products. You can pick them up at a local store, you can buy them online and try them at your own home
Right.
and convenience. Maybe you want to try it alone first, with some solo time, throw on some music that can be good.
Yeah.
Adults Only by Club 69 is a great
Yeah.
option. They have long songs, so sometimes getting through one means you're already in the average time for the typical male to
Yeah.
ejaculate.
And they're the perfect soundtrack for your experience. They have sensual songs, they have songs that are very sensual.
Yeah.
So give it a try. It's from the 90s.
Yep. And
House.
it's adults only. I mean,
Yeah.
it's literally telling you
Yeah.
who it's for. So consider trying that. But yeah, time yourself, put on some music. Are you trying to up your game? Are you trying to prolong your encounter? Maybe you want to practice making things more spicy for
Yeah.
you and your partner. So it can really be for anyone as long as you don't have an allergy to the active ingredients. But again, you just want to take precautions to make sure it doesn't impact your sexual experience negatively in any way. But yeah, if you're out there and asking, hey, how can I prolong my sexual experience? This may be right for you. Have you tried a delay spray before? What brand or what type have you used that worked well for you? I'm sure people
Yeah.
below in the comments may appreciate you providing us your recommendations. While I don't have a specific brand that I would recommend at this time, there's so many good options. Talk to your doctor. Just Google, find one that has some good reviews and see what you think. Let us know if a delay spray worked for you.
Absolutely. We are eager to hear if you have any brand that you recommended to us and to the other viewers. And please, if you haven't yet, like this video, subscribe our channel, share the video, like, post to which one.
Yeah, and we'll be back next week with another video that will probably be related to sexual health, as that's typically our topic format. But
You
if you
know.
have other things, leave them in the comments below for us to address. And we look forward to seeing you next week.
Yes, bye.
See you then.
See you. I wonder if anyone out there knows about Club 69.
I know.
They're
It's a
so
great, I mean,
good.
we didn't know I didn't know until,
Entire life.
yeah, till this year, right?
Yeah.
And so I'm
They have a
obsessed.
song that is the most famous, Sugar Pie Guy, which is pretty popular, especially during Pride.
Yeah.
But the other songs are just as good.
I know. I mean, I like all of them, and I think they're perfect for setting the mood, setting the tone. Very classic 90s pop. It's light disco vibes.